We sat together
I didn't prepare anything to say, but I don't think I'm Dr. Grazi much to say. First, I want to thank our sponsor for tonight. Came through the flying colors, pharmacy, Craft Pharmacy. I want to go out and support them. It's going to be appreciated by all parties. Someone who supports the organization and supports Dr. Grazi. And I want to welcome everybody for coming and thank Dr. Grazi for taking out of his time to be here. I was just thinking a few minutes ago, where does it come into this week's passion? I was thinking this is passion from Moshe Rabbeinu sent the Meraglim to Eretz Yisrael. Meraglim came back with what? With Peiris Eretz Yisrael. Kids are Peiris. We all want the Peiris of Klal Yisrael. On the Peiris, the Meraglim had nothing to say because the Peiris from Klal Yisrael are the best Peiris that they can be. And when it comes to fertility, Hashem has no problem researching and searching for the right Peiris. So with Dr. Grazi's help and with his understanding and with his devotion, not only in devotion as a doctor, just devotion as a Yid to a Yid, he has helped hundreds of couples and very knowledgeable in the field of fertility, and it's a pleasure to have Dr. Grazi come speak tonight on the assisted reproductive, whatever the title is. Technology. I'll get it.
My suggestion, if you're filming, is you do a show me for that introduction. And you may be wondering, how did I come up with such a title for a lecture? Actually, I wanted to be a little bit more provocative, but I thought that for a small group it would be appropriate to do something a little bit different. I think we spent the better part of the year, if you consider this the end at least of the academic year, that you get together periodically and people are bringing you the cutting edge technology, and really we speak, doctors in our field speak so often to audiences, to professional audiences, but also to lay audiences, potential patients, and I, like every one of my colleagues, wants to tell you that I have the secret of life. I don't want to disappoint you, but I'm working on something. This is my first presentation about what I think you need to know about the secret of life, because I hear even when I'm talking to you before the actual presentation that you're under the conception, or I should say the misconception, that somewhere out there lies the secret of life. And, well, we'll see. I think those of you who follow the news know that just last week there was a major announcement in all the newspapers, a major announcement all over the world, that a researcher, actually an entrepreneur by the name of Craig Venter, described that he has created life in the laboratory. And the way that he's created life in the laboratory is by taking DNA and putting it into a cell, and that DNA he fashioned by a computer. So the parent of this cell that was able to reproduce is actually his computer. And so for some people, the secret of life is in DNA. And does everyone know what this is a picture of? Does anybody not know what this is a picture of? This is the double helix DNA that provides the genetic code that tells every cell in our body to do what it's supposed to do, and really it is the basis for making us who we are. And so, in a very real sense, DNA can be thought of as the secret of life, but as we'll see later, it's really not. And I can't present that to you as the secret of life. So I wanted to go with some other things that I think are important and are a result of some thoughts that I had that I'd like to share with you before the summer if you're going through the struggle with infertility, things that I think you should know. And the first thing that I thought about was something that comes up very, very often in the context of counseling a couple. And that is the value of persistence and care. That when you go through treatment for infertility, you want things to work the first time you do them, and when they don't work the first time, it feels like they're never going to work. So you try a second time. It's a big deal to get back on the horse a second time. Then when it doesn't work again, you have despair. And it's very difficult to do things again and again and again. But over time, water, which seems like it's weaker than rock, carves out mountains and valleys and rivers and streams. And over time, water carves the rock. And that's really the value of persistence. And the reason that you need to be very persistent with the treatment of infertility has to do with this problem, if you will, that is an underlying fundamental fact of human fertility, which is that if you look at what happens with natural conception in couples that will have no problem getting pregnant at all, still, most embryos that are formed in nature, the result of an egg being fertilized by a sperm, do not grow into babies. What happens with them? This is a result of studies that were done many years ago and have withstood the test of time. When an egg is fertilized and an embryo is formed, about 30% of the time it will fail to implant. And another 30% of the time you will have a very early pregnancy loss. If any of you have gone through what's called a chemical pregnancy, that's what this is. It's an implantation. We see it as a positive pregnancy test, but that implantation is very brief and we don't see the growth of the embryo, and if the doctor tries to do a sonogram, they're not able to see anything actually developing in the uterus, and then the pregnancy hormone level goes away and the woman gets her period. It might be a little bit late, it might be a little bit heavy, but there's no baby there that grows. So out of 100 embryos that are formed in nature through natural intercourse, 30 will not implant, 30 implant briefly, and only about 40 of them go on to become a clinically recognized pregnancy, where a woman is late for a period, she feels symptoms of pregnancy, she goes to the doctor, the doctor sees a sac growing in the uterus, there may be a fetus there with a heartbeat, and then even those 40 out of 100, even for those, about 15 to 50%, depending on the age of the woman, will end up being lost. And there will be a clinical spontaneous abortion. And only about 30 out of those 100 embryos end up getting born. That's nature's scheme for human reproduction. And it makes us very complicated. We're not like laboratory animals where we can get pregnant with every act of intercourse or every act of fertilization. A lot of things have to happen just right. So where we would wish that things would be very simple, that, I don't know if you've ever seen a picture of a laparoscopy, but this is what things kind of look like inside. So this is a picture of the pelvic organs through the belly button. The little telescope is put through. This is what doctors see when they do laparoscopy if everything is normal. This is the uterus, and these are the fallopian tubes, and these are the ovaries where all the eggs are stored. What you would want to think is that all you need is just very simple things. And ovulation is one of the very few pictures that you can see of ovulation. This is a close-up view of the ovary, and this is what an egg follicle looks like. Anybody who's been to a reproductive specialist knows about egg follicles. And this is showing the actual release of the egg in a little bubble of fluid called the cumulus. And you can actually witness ovulation if you do a laparoscopy at the exact right time. And you would want an egg to be fertilized by a sperm. The sperm obviously have to penetrate into the shell of the egg. And the way that that happens is just depicted by this little cartoon here, showing the egg binding to the shell, the sperm binding to the shell of the egg, and wiggling its way through. That's why sperm need to be motile or moving, and they need to be normally shaped in order to get all the way through that shell. And then what happens is the sperm tail goes away, and the DNA inside the sperm head commingles with the DNA inside of the egg nucleus, and an embryo is formed. And we can see that when we examine embryos under the microscope, we can see two pronuclei. And later on in development, as the embryo grows, it has to travel down the fallopian tube. There's a picture of an embryo in the background of these folds inside the fallopian tube. Those folds are very important because they nourish the embryo during its early life before it gets into the uterus, and they help to propel the embryo into the uterus. Everybody knows about tubal pregnancy. Sometimes it happens. That happens when the embryo doesn't make it quite all the way into the fallopian tube. And so we're hoping that all it would be is a matter of an egg coming into contact with sperm and then dividing after the DNA, the genetic material is fused, and then splitting and developing and making its way into the uterus. And in fact, when we talk about IVF, by the way, this is one additional stage that happens, which is showing the embryo hatching out of its shell. And what we would simply want in a case of reproductive failure, where there's a problem with eggs, or there's a problem with sperm, or the fallopian tube is blocked, that all you would need to do in the IVF lab is simulate what happens in the body, just bypass all of this by taking eggs out, putting them with sperm, and then bringing the embryo into the uterus, and a woman should get pregnant every time you do it. So when drugs don't work, Clomid doesn't work, injectable medications don't work, insemination doesn't work, so at least you could turn to IVF, and it should work every time, and it should work for every couple. And if the sperm counts are low, should be able to do this procedure, which is the ICSI procedure, where we directly inject sperm into the egg in order to help them to get inside. And then what you want to see is an embryo here showing there's a real human embryo at the pronuclear stage. And if you follow the egg development, you see how now the new embryo divides into 2 cells and 4 cells and 8 cells. And then it becomes what's called a blastocyst on around day 5. And then the next day it hatches out of the cell. And that's what we do when we put embryos into the uterus, and it should work every time. But it doesn't work every time, because coming back to this slide which I showed you before, human reproduction is a very complicated affair. In nature, when nothing is wrong, and couples are going to have 10 kids without ever seeing a reproductive specialist, they still are subject to these problems, which is that there's a lot of implantation failure. And the reason that there's a lot of implantation failure is complicated, and I'll get into it a little bit further, but what you see here is a age-related graph showing that this problem, which refers to genetic imbalances in embryos, is seen more frequently as women get older. And for whatever the reason is, in the secular world, we certainly see a lot of women who are at the later ages where there just aren't any good eggs left. There are eggs left, but there's a lot of genetic imbalances. And sperm can have genetic imbalances also. And if the embryo is not balanced, it's not going to implant. And if it implants, it won't grow into a baby. So a miscarriage will occur. And that's nature's way of making sure that most babies that are born are normal. This is also the reason why, if you look at pregnancy rates, everybody likes to show you their wonderful pregnancy rates. But it doesn't matter what clinic you're at. It doesn't matter what country you're in. It doesn't matter what protocols you use. It doesn't matter what new inventions you bring to the table. Human pregnancy is subject to certain limitations, which is that as age increases, pregnancy rates go down. And the reason for that is genetic imbalances in eggs and in sperm to a certain extent also. And this is the reason why, if you look at all of the data from IVF, IVF is the most regulated, I'll say this for the record, IVF is the most regulated medical specialty in the United States. There's no other medical specialty that has to report on its success rates every year to the federal government. IVF is regulated by the FDA, IVF is regulated by the New York State Tissue Bank. So we have to report our statistics. This slide is about a year old, and it's generated by the cumulative statistics for all IVF programs in the country. And what it says, if some of you know a little bit more or less about IVF, you know that we like to transfer embryos at the blastocyst stage. That's the most developed stage that we can. And pregnancy rates are highest when embryos get to blastocyst before you put them in. But even then, if you look at the statistics for women who are older, quote unquote, older, not old, and you look at women who have a lot of blastocysts put in, let's say in a 38-year-old, if you put in 4 blastocysts, probably not a good idea, but if you did, your pregnancy rate would still only be about 35% per cycle, and not everyone would deliver. The blue line is the delivery line. And your twins, when you see twins about 10% of the time, and you see triplets maybe 1% of the time. But if you get into the older group, even if you put back 4 or 5 or 6 blastocysts, how many times does a woman get pregnant with triplets? 0. Because it's not possible at that age that all of the embryos are going to be genetically normal. And so the younger you are, the less embryos you put in. We try to put in 1 embryo. That's the goal. 1 embryo, 1 baby. But the reality is that not every embryo is going to be capable of growing into a baby, and that becomes more of a problem as you get into the older age groups. So when we look at those tables, we have to remember that those are pregnancy rates per cycle, not per patient. So if a couple that's 23 years old comes to me, and a woman's 23, a husband's 24, and he has a low sperm count and nothing has worked, what's the chances that they're going to get pregnant? 100%. What's the chances that they'll get pregnant on 1 cycle? 50%. And the next try it's going to be 50%, and the next try it's going to be 50%, but everybody ends up getting pregnant. When you talk about older age groups, you have to try it more and more times because of the problem with reproductive physiology that I told you. Most human conceptuses or embryos are not genetically capable of growing into an embryo. So persistence, and we see this all the time, is so important. how often do we have to tell patients to do something yet another time, even though they failed? And you know what they think? They think the doctor's not paying attention. They think that we're not really looking well at what's going on because we're telling them to do the same thing another time, maybe in a different way, maybe to try to get more eggs, maybe to try to get more sperm, maybe to pre-treat one of the partners differently. But persistence is very, very important. And that's why I have on my desk, here, take this one. I have on my desk a little rock that says, never ever quit. And I mean that because we see that couples that are focused and that understand that this is a process are usually successful. As a matter of fact, within certain limits and depending on what it is that you're willing to do, virtually everyone can have a baby. The second thing I have hanging in back of my desk so that every patient can see is that worry really is the misuse of your imagination. People worry about everything. As a matter of fact, most of the time they tend to worry about things that they don't need to be worrying about. And that's because they have a lot of noise coming at them from different venues. The neighbors are telling them one thing, their parents are telling them another thing, they heard something from a group, they went online and got the most nonsensical things that you can think of, and so they're worried about everything. As a matter of fact, sometimes, not sometimes, virtually always, when a treatment that seems like it should be successful fails, patient or couple decides that they found a new reason for why they're not getting pregnant. I know why I'm not pregnant. There's something wrong with my uterus. I can't hold the baby. I'm allergic to my husband. I fell 4 days after my embryo transfer. I had a fight with my mother. My stress is too high. All of these things that you're worried about are not really impacting your chances of becoming pregnant. They're noise. They make going through the process of getting treatment for pregnancy much more unpleasant because of the worry factor. But they don't actually influence your chances of conception occurring. What is important is to understand what are the limitations of the technology that you have to use. So I want to explain to you something about new stuff, but again, my focus is not really on the new stuff. Anybody ever see pictures of this? It's pictures of chromosomes from a cell. When you grow a cell and it starts to divide and you stop the division and you look at the nucleus in the cell, you see these things. And those are human chromosomes. More likely you see them aligned and numbered. And there are 23 pairs of chromosomes in every cell. There's either two X's or an X and a Y, depending on whether you're male or female. Most people know what happens if you have an extra 21st chromosome, right? It's called Down syndrome, trisomy 21. That's a very peculiar type of aneuploidy. Remember I mentioned that word aneuploidy? Very peculiar type. Most embryos with a number of chromosomes that does not equal 46 never get born. They have implantation failure, or they implant and they're responsible for early miscarriage. People with Down syndrome all have an extra 21st chromosome, and that makes them unusual. They're born with 47 chromosomes and they're able to live. There are certain girls that are born missing an X chromosome. They only have 45, and that's called Turner syndrome, and they can be completely normal except that they're born without any eggs. It is a struggle when we find out that they're having that condition. Now, what are chromosomes? If you look at the nucleus of the cell under a microscope, after it's been in the midst of a division, you'll see these chromosomes. They look like this. And inside the chromosome, why is a chromosome so important? Chromosomes are relatively big structures inside the cell. But if you look closely and you unwind it, what you'll see is that the DNA, that double helical structure, which is the carrying the genetic code is tightly wound into the DNA, a strand of DNA in every cell that long. And it's packaged tightly into every single cell in the body, and it has to replicate itself every time the cell divides. It's not a miracle, it's part of the scheme of the Borei Olam. And we know a lot about DNA, and we know a lot about chromosomes, but we don't know how to fix the failures of normal chromosome fusion. But we can make diagnoses. And this is a technique that's been around for about 18 years now, called embryo biopsy for pre-implantation genetic diagnosis. What's the purpose of doing that? The purpose of doing that is to take a cell out of the living embryo before you implant it back. This would be the cell removed with a little pipette. And to do a genetic analysis of that cell to try to screen for genetic disease, for example, if a couple are both carriers for a genetic disease, or to do something called fluorescent in situ hybridization, or FISH, which refers to the fact that chromosomes can be made to light up if you stain them with certain chromes. And we can count chromosomes inside the cell. This is a cell that's been fixed, sent to a laboratory, and stained to show certain chromosomes. And what you can see here is that there are 3 red chromosomes. So that embryo has trisomy 21. That's not an embryo that you would intentionally want to transfer into a woman. And that technology is very powerful, and as I said, it's been around for a long time. But an even more powerful technique today is not to look at whole chromosomes, but to actually look at the unwound fragments of DNA, so you can get a complete genetic analysis of the embryo and look at all the chromosomes together, and as well little mutations of the DNA by unwinding the chromosome and breaking DNA and labeling it with probes. And this is called microarray. So if any of you are following what's new in reproductive medicine, it's certainly pre-implantation genetic diagnosis using microarray trips. But that's not the secret of life either, unfortunately. Because not only does an embryo need to be genetically normal, it needs to implant into a normal uterine lining. And the uterine lining is a very complex organ. It grows and sheds every month. It's responsive to hormones, and it makes stuff at different stages of the cycle. And that stuff, integrins, for example, different kinds of glue, if you will, to make the embryo stick, will be either present or absent and able to accept the embryo for implantation or not. It's another thing that is important in the occurrence of pregnancy. And we also know that metabolic products of the embryo as it's growing can give us a clue into how the embryo is doing. And there's new techniques now to look at the solution that the embryo has been growing in and to analyze those solutions in order to make sure that the embryo within it is normal. That's called metabolomics, from the word metabolism. Embryos undergo metabolism as well. And so what we believe that will happen in the future is not just the transfer of a well-developed blastocyst into the uterine cavity, but actually testing of the embryos for metabolism, for protein products, and of course for its genetic makeup, with the ideal outcome being the transfer of one single embryo into each woman with 100% guarantee that that embryo will form into a baby that gets born. Those are not things that are controllable by how active you are, or whether or not you had a fight with your mother or your husband, or with your wife, or whether you sneezed after the embryos were put in, or went to the bathroom, etc., etc. So don't worry about the things that you cannot control and that are not actually important about the reproductive process. So I think that that deserves to be second secret of life. The first being the lesson of persistence. The second is the